The Evidence2Practice Ontario program is supporting the delivery of care across the province by making it easier for clinicians to access and apply best practice information and quality standards at the point of care. E2P is co-led by the Centre for Effective Practice, eHealth Centre of Excellence, and North York General Hospital, and funded by Ontario Health. Disclaimer: our goal is to support clinicians with care decisions while also optimizing clinical workflows. Please consider these supports a supplement to clinical care rather than a replacement. We deeply value the work clinicians do each and every day to provide high-quality patient care. Welcome to the E2P Diabetes Tool, your comprehensive companion for diabetes screening and management within Accuro QHR EMR. Join us as we navigate through its features and functionalities. The tool is designed to support evidence-based decision-making by presenting key clinical information, guiding assessments, and recommending appropriate interventions. Key features of the tool include supporting clinicians with early identification for patients at risk of developing diabetes and complete management for patients with type 2 diabetes, provides access to the CAN risk and PAID questionnaires, InLow's 60-second diabetic foot screen directly embedded into the tool, features the PHQ-9, GAD-7, and WHO-5 screeners to support the management of comorbidities, and promotes personalized, patient-centered care by recommending evidence-based treatment options tailored to the individual patient's needs. For a patient with new or recent pre-diabetic concerns, clicking on the E2P Diabetes Tool in the Forms list will open the Diabetes Tool. To navigate between modules, you can use the left and right page arrows at the bottom. In this workflow, users can open the CAN risk screener in a separate window to complete the screening for pre-diabetic patients. The CAN risk diabetes screener does not provide a definitive diagnosis, but instead assesses the risk level for developing diabetes. Based on the results, clinicians can consult the screening frequency pop-up to determine how often the patient should be screened. Additionally, the Diabetes Canada screening and diagnosis algorithm is integrated into the tool, allowing users easy access when interpreting A1C or FPG results. To support screening and diagnosis, the tool includes a reference table that outlines the target ranges and recommended screening frequencies for the relevant diabetic lab results. To further support visit documentation, the clinician discusses the patient's current health since the last visit. Within the assessment section, the clinician then records symptoms under the subjective section, such as the patient experiences tingling or numbness in their hands or feet. If lab work was completed and reviewed with the patient, the clinician can check off the reviewed lab results box. Should there be labs ordered, there is info available within the tool pop-up to guide initial and ongoing investigations as well as guidelines for A1C targets. If the patient has any potentially related comorbidities, the clinician can document relevant complications under the objective section. For patient 2 who has a confirmed diabetes diagnosis, clinicians will open up the tool for a routine follow-up visit. If the tool modules have been completed in a prior visit, clinicians have the option to use the Copy from Prior button, which will pull all data for each section into the form so clinicians can update existing notes, further aiding the complete and comprehensive documentation of the patient's care journey. In the management section, the clinician discusses lifestyle considerations such as physical activity, nutrition, and smoking cessation as the main topics of discussion for the visit. The focus of the tool is to ensure patient-centered supports are in the right places at the right times in the tool. Clinicians can create a list of both active and external medications from the patient's chart, enabling clinicians to document details related to monitoring, adherence, and treatment response. Additionally, there is a section for cardiovascular protection where clinicians can note if the patient has been prescribed medications such as statins, ACE inhibitors, ARBs, SLG2 inhibitors, and more. An essential feature in the medication section is a medication reference tool designed to offer comprehensive information on non-insulin therapies, insulin treatments, and combination products. It provides details such as insurance coverage, dosage guidelines, costs, and more. This link to the meds reference table can be saved to be used outside of the visit form as well. Lastly, The referrals and follow-up section offers the ability to record if a referral was sent out and to document follow-up notes. At the end of the visit, the clinician can curate a package of patient resources and continue to fill in the patient care plan. User and installation guides are available for download on the community portal. If you do not have an account, please visit this website. The change management team will be happy to support you if you require assistance with installation. Please reach out to Evidence2Practice at cep.health. Dedicated to supporting primary care clinicians, allied health professionals, and clinic staff, the eHealth Center of Excellence offer guided tool installations and technical setup and guidance on how to optimize the integration of the tools into your existing workflow. In addition, our partners at the Center for Effective Practice can offer supplementary one-on-one discussions with an academic detailer on balanced, evidence-based information on insulin therapy for type 2 diabetes and non-insulin therapy for type 2 diabetes. With E2P, clinicians can provide enhanced care for their patients, all while reducing their own workload and stress. Try our diabetes tool today, and remember, our team is here to help. Learn more or sign up at E2P.ca today.